More and more we're seeing units go into more austere locations, and we know that the window of time for evacuation is getting longer and longer. 5.4 million snake bites occur globally every year, and of those, up to 138,000 deaths per year.
Not only is it a true issue, especially when you're looking at certain regions of deployment, but it is also a fact of their comfort level as they're being deployed out into these areas. So the Broad-Spectrum Snakebite Antidote Program, or BSSA for short, the end goal of this program is to have an FDA-approved, shelf-stable, broad-spectrum antidote that is species agnostic.
Traditional antivenom is how we combat snakebite envenoming now, and it has a lot of problems. So it can be very expensive. It's species specific, so you need to know which snake bites you to know which antivenom to use. Many different antivenoms require refrigeration, cold storage. That poses a logistical problem. And they're injected, which means a medic has to administer it.
And every hour that passes from bite to treatment could result in a 1% greater mortality rate.
So this program is intended to find a solution to all of that, something that would be shelf stable, that would reduce the logistical burden, that would be broad spectrum, so it would counteract venom from lots of different snakes, and would be easy to use, something that could be used in austere Role 1 conditions. We had a lot of interest from both the special operations community as well as some of the different combatant commands, AFRICOM in particular. The Defense Health Agency invested in a phase 1 proposal for the Small Business Innovation Research, or the SBIR program. So the research got started there. This is what we call a tech pull from industry, where an industry partner has the intellectual property, but what they're doing fits our needs. And so we're able to invest in that technology to move it forward and to make sure that the military requirements are covered.
I think this is truly an exciting team to be on.
We have logistics experts, we have financial analysts, members from SOCOM, we have members from the combatant commands, medics, and other folks that might use this, so that we're not just developing something that is safe and efficacious, but that it's usable.
This could be a large game changer, and not only hitting military medical needs, but also, again, the humanitarian piece.
This is a first of its kind. People who need it would be able to have it in their pocket, and so we can go into those austere locations. We can deal with a wider evacuation time, because now we're looking at just a tablet, a self-treatment to combat snakebite envenoming versus something that has to be injected by a medic and pulled out of the refrigerator.
Just having something in your pocket, or knowing that a medic has something readily available should that occur, that can put your mind at ease too.
Think about anybody who is worried about snake bites, right? That can be people who spend a lot of time outdoors, hikers, campers, hunters, people in agricultural business. But it's also a huge deal for global health. This is really a game changer for combating snakebite envenoming.